This is long axis traction we have in the office. Right now we are getting Lindsay set up to traction her lower back. Shelby's getting her all tied down there. We'll kind of go over some of the different settings here. There's different things. I mean, not that anybody really needs to know all this detail here, but if we get in here, there's different settings for acute pain, acute kind of intermittent pain, muscle spasm. So if you come in, you're in some pain, we want to try and get that back kind of calmed down so that you don't kind of react or tense up when we're going to go and try and get you adjusted. This can help kind of calm some of that stuff down. And there's also, for muscle spasm, we get a lot of patients coming in where they're going to have especially spasm in the lower back of the hip flexor muscles, and we'll literally get them on the therapy here, and this will help reduce some of that muscle spasm. There's also some disc decompression therapies that we have on here, as well as some oscillation therapies, more for people that have some degenerative discs. That helps out a lot in helping to rehydrate the discs there, so that people that do have degenerative discs, they'll start to notice that they have much better range of motion, less pain and discomfort. Some of them do have radiating pain symptoms going down into their legs, and by utilizing the traction there, we can help reduce some of those symptoms just by kind of helping pull apart the vertebra and helping to reduce some of the inflammation, especially where they have some of the degenerative changes occurring in their lower back in this case, when we're getting Lindsay hooked up here. So we get all these straps tied to people here and some blocks just in case people kind of slide on the table there. They can kind of use those to kind of help hold themselves in place. How are you feeling, Lindsay?
So far, so good.
So far, so good. Occasionally people can get a little bit claustrophobic with this, so if you do have a little touch of claustrophobia here, you might want to let us know so that we can just make sure we should make some adjustments so that we do it maybe in even a different position here, so that you're not getting claustrophobic and we're having to stop the therapy before we even finish it here. So I guess if you have any questions here on the long axis traction, if you have a disc condition or some degenerative joints, this definitely is a super helpful tool here in therapy to help reduce some of those symptoms. Just give us a call at the office here. We can get you in for an initial assessment, see if you do have some things going on that this could help with, and we can develop a treatment plan for you.